Hey everyone, and welcome back to our channel. There's something so comforting about the smell of garlic sizzling in a pan, isn't there? It's a flavor that feels like home, a staple in kitchens all around the world. For thousands of years, we haven't just loved garlic for its taste. We've turned to it as a remedy for all sorts of ailments. But have you ever stopped to wonder what's really going on when you eat this powerful little bulb? Is it a superfood that can supercharge your immune system? Or could it be hiding a few risks we should know about? Today we're going to peel back the layers on garlic, separating fact from fiction, so you can make the best choices for your health. So let's start with the big question. Can garlic actually boost your immune system? Many people swear by it, especially when cold and flu season rolls around, and there's some exciting science to back this up. Garlic is packed with compounds rich in sulfur, and the star player is called allicin. Allicin is what gives garlic its distinctive, pungent smell and taste, but it's also responsible for many of its health benefits. Think of allicin as the garlic's personal bodyguard. It's only released when garlic is crushed or chopped, as a defense mechanism for the plant. When we consume it, this allicin and other related compounds can stimulate our own body's defenders. According to a review published in the Journal of Immunology Research, certain components in garlic can enhance the function of immune cells like macrophages and lymphocytes. These are the frontline soldiers of your immune system, responsible for hunting down and destroying invaders like bacteria and viruses. For example, a notable study published in Advances in Therapy involved 146 volunteers. Over a 12-week period during the winter, one group took a daily garlic supplement, while the other took a placebo. The results were quite striking. The garlic group experienced significantly fewer colds than the placebo group, and for those in the garlic group who did get sick, their symptoms lasted for a much shorter time. Another review from the Cochrane database of systematic reviews also looked at this. And while it noted more high-quality research is needed, the existing evidence points towards garlic being helpful in preventing and reducing the severity of the common cold. So the idea of garlic as an immune booster isn't just an old wives' tale. The allicin and other sulfur compounds appear to give our immune cells a helping hand, making them more active and effective. It's like giving your internal security team a pep talk and some better equipment. But that's not the only benefit people talk about. Garlic is also widely praised for its potential heart health benefits, particularly its effect on blood pressure and cholesterol. Let's look at what the science says there. Cardiovascular disease remains a leading health concern globally, so anything that can naturally support heart health is worth exploring. The National Center for Complementary and Integrative Health, or NCCIH, part of the U.S. National Institutes of Health, has noted that studies suggest garlic can have a small but positive impact on both blood pressure and cholesterol levels. Let's talk about blood pressure first. High blood pressure or hypertension forces your heart to work harder and can damage your arteries over time. Several meta-analyses, which are studies that combine the results of many other studies, have found that garlic supplements can lower both systolic and diastolic blood pressure in people with hypertension. The effect is modest, often compared to some early-stage blood pressure medications, but it's a significant finding for a natural food. The compounds in garlic are thought to help relax and widen blood vessels, making it easier for blood to flow through. Now, what about cholesterol? High levels of LDL, or bad cholesterol, can lead to plaque buildup in your arteries, a condition known as atherosclerosis, which increases the risk of heart attack and stroke. Research, including studies cited by Johns Hopkins Medicine, indicates that garlic can help lower total and LDL cholesterol. It seems to work by inhibiting the liver's production of cholesterol. Again, the effect isn't dramatic enough to replace prescribed medications for those with seriously high cholesterol, but it can be a valuable part of a heart-healthy diet and lifestyle. So we have this incredible plant that can help our immune system fight off colds and may even support our heart health. It seems like we should all be eating as much garlic as possible, right? Well, this is where we need to pause and look at the other side of the coin. The very properties that make garlic beneficial can also introduce some risks, especially for certain people. The main concern revolves around garlic's effect on blood clotting. We just talked about how garlic can help relax blood vessels. Well, it also acts as a natural blood thinner. Its compounds can reduce the stickiness of platelets, which are the tiny blood cells that clump together to form clots and stop bleeding. This is generally a good thing for preventing unwanted clots inside your arteries. However, this blood-thinning property can become a problem if your blood is already too thin, or if you're in a situation where you need your blood to clot properly. According to Memorial Sloan Kettering Cancer Center's website, which provides evidence-based information on herbs and supplements, garlic can increase the risk of bleeding. This is particularly important for anyone who is already taking anticoagulant or antiplatelet drugs, medications commonly known as blood thinners. Think of drugs like warfarin, clopidogrel, or even daily aspirin. These medications are prescribed specifically to prevent blood clots. If you add garlic, especially in high-dose supplement form, into the mix, you could be amplifying that effect. It's like adding an extra blood thinner on top of the one you're already taking. This could lead to an increased risk of bruising easily, or, in more serious cases, prolonged bleeding from a cut or internal bleeding. This is why it's a standard recommendation for people to stop taking garlic supplements at least 1 to 2 weeks before any scheduled surgery. The surgical team needs your body's natural clotting ability to be fully functional to control bleeding during and after the procedure. This doesn't mean you can't enjoy a little garlic in your spaghetti sauce. The risk is most pronounced with concentrated garlic supplements, where you're getting a much higher dose of the active compounds than you would from a few cloves in your meal. For most people, dietary garlic is perfectly safe, but if you're taking blood-thinning medication or have a bleeding disorder, it is absolutely crucial to talk to your doctor before you start taking garlic supplements or dramatically increase the amount of garlic in your diet. They can help you understand the potential interactions and advise you on what's safe for your specific situation. Beyond the bleeding risk, there are a few other less severe side effects to be aware of. The most common ones, as you might guess, are breath and body odor. That pungent allicin is metabolized, and its byproducts can be released through your lungs and sweat glands. For some, high doses of garlic, especially on an empty stomach, can also cause digestive upset, things like heartburn, gas, and bloating. This is more common with raw garlic, as cooking can mellow some of these potent compounds. So how do we balance all of this? How can we enjoy the fantastic benefits of garlic while minimizing the risks? It really comes down to a personalized and mindful approach. First, let's talk about the source. For most healthy individuals, incorporating fresh garlic into your cooking is the best and safest way to go. You get the flavor, the aroma, and a healthy dose of its beneficial compounds without the high concentration found in pills. To maximize the health benefits, try crushing or chopping the garlic and letting it sit for about 10 to 15 minutes before you cook it. This pause allows the enzyme alliinase to convert alliin into the powerful allicin. Lightly cooking it is fine, but prolonged high heat can destroy some of these valuable compounds. If you are considering garlic supplements for a more targeted health goal, like managing blood pressure, the key is to be smart and safe. Look for reputable brands that standardize the amount of allicin potential in their products. This ensures you're getting a consistent dose. But most importantly, and I cannot stress this enough, if you have any pre-existing health conditions, especially bleeding disorders, or if you are taking any medications, particularly blood thinners, anti-diabetic drugs, or medications for HIV, you must consult with your healthcare provider before starting a garlic supplement. This isn't just a suggestion, it's a critical safety step. Bring the supplement bottle with you to your appointment. Your doctor or pharmacist can review the ingredients and dosage and check for any potential interactions with your current treatment plan. They are your best resource for personalized medical advice. And what about for those who are pregnant or breastfeeding? The NCCIH suggests that eating garlic in food is likely safe, but the safety of medicinal amounts of garlic during pregnancy and breastfeeding isn't well established, so it's best to err on the side of caution and stick to normal dietary amounts. Ultimately, garlic is a wonderful example of how food can be medicine. It has a rich history and a growing body of scientific evidence supporting its role in boosting immunity and supporting heart health. But like any powerful tool, it needs to be used with respect and understanding. It isn't a magic bullet, but a piece of a larger puzzle. A healthy lifestyle with a balanced diet, regular exercise, and stress management is always the foundation. garlic can be a fantastic, flavorful addition to that foundation. So go ahead, enjoy that delicious garlic bread, add an extra clove to your stir-fry and savor the rich taste it brings to your meals. By being informed about both its amazing benefits and its potential risks, you can make garlic work for you in the safest and most effective way possible. Thank you so much for joining me today to explore the fascinating world of garlic. I hope this discussion has been helpful and cleared up some of the questions you might have had. If you found this video valuable, please give it a thumbs up and consider subscribing to our channel for more deep dives into health and wellness. We'd love to hear from you in the comments below. How do you like to use garlic? Do you have any stories to share? Stay healthy, stay curious, and we'll see you in the next video.